And I tell people about 7 out of 8 patients have a really good result with this procedure. And when I say really good result, what I mean by that is that for those who have elevated symptom scores, say in the moderate to severe range, we'll usually get your score down by about 2/3. So let's say you were in the low 20s, we might get you down to like 7 or 8. If your scores were, a lot of 3s and 4s and 5s, we usually get you down to some 1s, maybe some 0s, maybe some 2s. So really substantial improvement. And that pretty much is aligned with the results that you get from any of the surgical procedures like the TURP, for example. And so that's kind of where 7 out of 8 patients are kind of at the end of month 1. So I'll usually see you back in clinic at that point for a follow-up appointment to check on you, see how things are going. And then over time, the gland actually shrinks over about a 3-month period. So you might even have a little bit more improvement over month 2 and month 3. And then we'll usually see you back again at the 3-month mark. And then we'll kind of, again, measure your post-coit residual, see how that's improved. We'll probably get a gland size measurement to see how much the gland shrank. Usually the gland will shrink by about 1/3 from its original size. So it'll shrink down to about 2/3 of what it was. And then, like I said, usually patients will have about a 2/3 reduction in their symptom score. So pretty much we get most patients into that mild symptom score range. It's important to understand that we're not going to make you 25 years old again, but we're just going to try and get you a sustainable, kind of reasonable urination pattern again. Now, when I say 7 out of 8 patients have a good result, well, what about that one patient that doesn't? Well, sometimes it just doesn't work. It doesn't matter what procedure you're talking about in the BPH world. Some things just don't work well for some patients. Usually it's more of a result of there being some other coexisting issue. Like I mentioned in one of my previous videos, patients can have overactive bladder that's kind of underlying and maybe, previously undetected. And so if you treat the BPH, treat the prostate, and the gland shrinks down, some of your symptoms may get a lot better, meaning kind of like the straining, the weak stream, the intermittency, the symptoms that are specific to prostate. But some of the symptoms like frequency and urgency and the nocturia, the times you get up at night, those may be more related to an overactive bladder, but then that will make your symptom score not improve so much. And so then we can work on that, kind of with other medications or other lifestyle modifications. So that's one reason why patients won't have a really good result. And that's usually the most common reason. For patients who have severe blood in the urine, we get about a 95 to 97% success rate in treating that. Usually those patients who still have a little bit of blood in the urine later on, it's because they're on a blood thinner medication, so patients with bad hearts or patients who had strokes in the past. And for those patients who have catheters in their bladder, just kind of chronic indwelling catheters, I tell people that overall, in the long term, about 3/4 of patients will successfully get their catheter out and have a good sustained kind of, comfortable urination pattern. We usually ask that patients wait 1 month after the procedure before we try taking the catheter out in those cases, because if you try and take the catheter out sooner, sometimes it's just too soon and the prostate hasn't shrunk enough. And sometimes after 1 month, we'll have the patient get the catheter removed and they'll fail what we call a voiding trial. They just won't be able to urinate adequately, and the catheter will have to go back in. Of course, that can be very discouraging. However, sometimes it just takes time longer for the gland to shrink down enough. So we usually ask the patients to come back 1 month afterwards. In other words, 2 months after procedure to try a voiding trial again. So that kind of summarizes what to expect with the PAE procedure, kind of the hours, the days, and the weeks and first few months after the procedure.